Welcome to Herb Nerd TV. Today, we're exploring a question that's been gaining a lot of attention. Can herbs replace antidepressants? With the growing interest in natural remedies, many people are turning to herbs as an alternative to conventional antidepressants. But can herbs like St. John's wort, rhodiola, and saffron truly stand in for medications like SSRIs? Let's dive into the science to find out. First up is St. John's wort, one of the most well-known herbs for managing depression. St. John's wort has been studied extensively, and several meta-analyses, including one published in the Journal of the American Medical Association, found that it may be as effective as some antidepressants for mild to moderate depression. The herb works by influencing neurotransmitters such as serotonin, dopamine, and norepinephrine, much like conventional antidepressants. However, there's a catch. St. John's wort can interact with many medications, including birth control pills, blood thinners, and even other antidepressants, sometimes with dangerous results. So, while it's effective, it requires careful management and should only be used under the guidance of a healthcare professional. Next is Rhodiola rosea, often called the adaptogen of choice for stress and mild depressive symptoms. A study published in the Journal of Phytomedicine showed that rhodiola can help reduce symptoms of depression and anxiety, particularly in individuals with mild to moderate depression. It's thought to work by regulating cortisol levels and improving neurotransmitter function, thereby boosting mood and energy. However, the evidence is less robust compared to conventional antidepressants, and it's generally recommended as an adjunct, not a replacement, for more severe depression. Saffron, the world's most expensive spice, has also gained attention for its antidepressant effects. Several clinical trials, including those published in Human Psychopharmacology, have shown that saffron may be as effective as certain SSRIs, like fluoxetine, Prozac, for mild to moderate depression. Saffron appears to work by increasing levels of serotonin, similar to how conventional antidepressants function. While the results are promising, most studies are small, and more extensive research is needed to confirm its effectiveness. Another herb worth mentioning is ashwagandha, known primarily for its stress-reducing effects. Some studies, like one published in the Journal of Clinical Psychiatry, suggest that ashwagandha may help alleviate symptoms of anxiety and depression by regulating the body's response to stress. While ashwagandha shows potential, it's not as well studied in clinical depression, and more research is needed to establish it as a standalone treatment for mood disorders. Let's not forget lavender, often used for its calming properties. A study in the International Journal of Neuropsychopharmacology found that lavender oil capsules can be as effective as low-dose lorazepam, an anti-anxiety medication for generalized anxiety disorder, which often co-occurs with depression. Lavender can aid in sleep, reduce anxiety, and enhance overall mood, making it a beneficial adjunct therapy for those managing depression. Now, let's talk about how these herbs compare to conventional antidepressants like SSRIs, selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors. SSRIs, such as fluoxetine and sertraline, are well researched with a significant body of evidence supporting their use in treating moderate to severe depression. They are considered first-line treatments due to their well-documented effects on brain chemistry. However, these medications often come with side effects like weight gain, sexual dysfunction, and withdrawal symptoms when discontinued. Herbs, on the other hand, generally have fewer side effects, but come with their own set of challenges. The quality of herbal supplements can vary widely, and dosing is often less precise than with pharmaceuticals. Additionally, the efficacy of herbs can be less predictable, and they often take longer to show noticeable effects compared to conventional medications. The key takeaway: while herbs like St. John's wort, rhodiola, and saffron show promise, they are best suited for mild to moderate depression and should be used with caution, especially when other medications are involved. For severe depression or complex mental health conditions, conventional antidepressants remain the more reliable option, often with herbs serving as complementary support. Always consult with a healthcare provider before starting or stopping any treatment, whether it's herbal or pharmaceutical. The best approach often lies in a balanced integration of lifestyle changes, therapy, and a carefully managed combination of herbal and conventional treatments. Thanks for watching Herb Nerd TV. If you found this video informative, please like, share, and subscribe for more evidence-based insights into herbal medicine. Stay well and see you next time. Meta description. Can herbs like St. John's Wort and Rhodiola replace antidepressants? Explore the science behind herbal remedies for depression and how they compare to conventional medications.